Hi, welcome. Come on in. I'm glad that you're here today. So, you will be shadowing me as I perform a full cranial nerve exam on one of our patients today. Yes, so feel free to take some notes, okay? I will be explaining everything that I do on our patient step by step, and you can just go ahead and study what I'm doing to help prepare you for your practical exam, okay? So here you go. I'll just leave that here with you. Okay, do you have any questions before we get started? Oh, no, I won't need you to do anything today. All you need to do is concentrate. But of course, if you do have any questions throughout the exam, feel free to just go ahead and ask. Okay, and I may be testing your knowledge along the way, asking you certain things or why I'm doing certain tests. Okay, but ready? Perfect. All right, so let's go ahead and we're going to bring our patient in. Hello there, come on in. You can go ahead and take a seat right here. So we do have our nursing student observing the session today, okay? Is that all right with you? Perfect, all right. So let's just go ahead and get started. I'm going to put some gloves on, very important, okay? So what we're going to do is just start with a general observation, okay? So if you could scoot a little closer, thank you. So just looking at your face here, noting any signs of injuries, trauma to the head, any obvious visual concerns. Taking a look at the general color of the skin. Looking for any rashes, spots. Okay. And how are you feeling today? Good. Have you been sick at all recently? Okay. Right. I'm going to take a quick look through the scalp. If you could just tilt your head down for me. Thank you. When we look through the scalp, we're just looking for lumps, bumps, anything at all. Okay. Just turn your head to the side for me. Let me just look here at the side. Okay. Looking at the top. And the other side. Alright. Just gonna feel around the head here. You want to be extra thorough, make sure you're really feeling any lumps or bumps. Any pain or any tenderness with that. Okay. Good. Right. Just making sure I take a good visual look here. Look along the hairline. Okay. Good. Great. We're going to begin with the eyes. Okay. Do you have any vision problems? Blurry vision, double vision? Okay, can Can you see me clearly today? Okay, what color is my pen light? Good. Okay. So we're going to start by just asking the patient to follow the light. If you could keep your head still and just with the eyes follow the light. Okay. Good. And as I'm doing this, I'm just watching to see if one eye wanders or struggles to track the movement. Very good. Okay. Now, just gonna hold your head here so it doesn't move. Can you just follow my finger? Great. And just bring it in, testing the depth to the nose. Good. Great. Okay. You can write that down that the tracking ability is good. Okay. I'm going to test the pupils. Alright. So just stare straight ahead, just covering up one eye. I'm just going to take a look at the other eye here. Good. Okay, it's reacting normally. I'm going to cover up the other eye. Okay, very good. Putting my hand in the center of their face, and here we're testing the direct, the consensual response on the other eye. Okay. And here we're just looking to see both eyes are in alignment. Same thing. Direct. The consensual response. Do you want to come a little bit closer and take a look? Do you mind? Okay. Yeah, just watch their eyes. Do you see that? Good. Okay. Great. Doing some peripheral vision tests now. Can you please stare at my nose? Thank you. And just let me know when you see my fingers come into your vision. Good. Good. A bit closer. Good. And here. Good. How many fingers am I holding up? Good. 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 Great. Good. Good. Now can you tell me which side is wiggling? You can just point to it, please. Okay. Good. 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 Perfect. Okay. You can note that down that the peripheral vision is all fine. Okay. Now, if the patient complains of some dryness or redness or irritation on the eye, you can do a closer examination. Okay, with that light like this. We'll also be using this light for checking the ears in a moment, but for that, you want to apply a tip like this one. But they usually come with a magnifying glass, so you can use it to have a better look at the eyes, okay? Do you mind if I come a little bit closer to you? Okay. Just pardon me, if you could just keep this eye open here. We're going to come up close and take a look. see any redness, which is great. Sclera looks nice, pearly white color. Everything looks nice and healthy. It's okay if you have to blink. Tear duct intact. Very good. Okay. And just coming in and checking the other eye here. Same thing. Very healthy color. Don't see any signs of dryness. Very good. Okay. And relax. Now I just want to feel around the eyes and the sinuses before we move on to check your face. Okay? So you just want to feel on the sides of the nose here and be very gentle when touching under the eyes. Just going on the eyebrows. Any pain, tenderness, discomfort. Okay. You just close your eyes for me, and I'm just touching on the eyelids. And just under the eyes. Okay, no swelling. Very good. Okay, I'm just going to feel the rest of the face now, moving down to check the facial nerve. Okay. Now I'm just going to palpate along the face, checking jaw muscles here. Temples, again, feeling for any swelling. The sides. You can go down the neck, feeling the glands and the lymph nodes. Now everything feels very healthy. Don't feel any enlargement. Thyroid. Okay. Okay. Can you please raise your eyebrows for me? We're just going to do some faces and test the muscles here. So raise your eyebrows. Good. I'm just going to try to push them down and keep them up. Excellent. Close your eyes really tight and don't let me open them. Good. You puff your cheeks out. Okay, and don't let me push the air out. Excellent. Good. Can you smile really wide for me? And frown. Okay. Good. You can relax. Now I'm going to grab this device here and could you just tell me what would I use this for and why? Yep. Check facial symmetry. That's what I'm gonna do. And why would we do that? Or why would we want to check for that? Yep. Yes, if there are any issues with cranial nerves, there can be some drooping or irregularities and asymmetry along the face. It's completely normal for your average person to have some irregularity and asymmetric features. Just looking for anything that is out of the ordinary. sometimes it's a little easier just to use this one here. Okay, if you could just hold still for me, thank you. You can just check the features, compare. Okay. So you can note down that just an acceptable, normal level of asymmetry. There's nothing to worry about. Okay. Sticking with the face here, let's go ahead and just do a soft or sharp sensation test. You can use a variety of devices for this test, but I'm just going to use this sanitary paintbrush. Okay. And it has a very delicate, soft side. Can you see that? And then, of course, the wooden side. So, if you just close your eyes, and you can just touch various areas very gently. And you can just say no when you feel it. Okay. Good. Is that soft or sharp? Okay. Yeah. Pardon me, you can say soft or sharp. Okay, good. Sharp. Soft. Soft. Sharp. Soft. Sharp. Very good. Very well done. Okay. So now just briefly checking your hearts and your lungs. Okay. Alright. And for this, it's best if it is sitting directly on the skin. So if you don't mind, I'm just going to adjust, move your shirt collar here. Okay. Good. You just want to place that right on the top of the chest. Okay. And just breathe normally for me. Just listening. A regular rhythm. Listening for clarity in the breathing. Okay. And now can you take a deep breath in and exhale slowly. Good. And another deep breath in and exhale slowly. Very good. Okay. Now you can go around to the back. I'm just going to lean in here. Okay. And another deep breath in for me. And slowly let it out. Amazing. Good. Okay. Yep, so heart rate and breathing is sounding very healthy. You can write that down. Are you still with me? Have you been doodling? Is it that boring? Okay, whatever helps you concentrate. Okay, I'm gonna move down to the jaw and the mouth, and we'll do some taste and smell tests. Okay. So, could you please open your mouth as wide as you can? You want to feel the joints here, and then close, feeling for any clicking, any pain or discomfort there. Okay, good. And now you want to do a quick internal check. If you could open your mouth for me, and I'm just going to press the tongue down with the tongue depressor. Okay, and say ah. Good. Looking for any redness or signs of irritation at the back of the throat. Alright, can you lift your tongue up for me? Good. And now stick your tongue out. Looks normal. Okay, can you put it to one side? And the other side. Very good. Excellent. I'm gonna grab a flavor drop here. And it's good to ask the patient if they have any allergies. So do you have any allergies? No? Okay. Good. I'm going to put a quick drop right onto their tongue, not onto the floor. Can you tell me what that tastes like? Mint. Very good. Okay. I'm just feeling down the neck. And can you swallow for me, please? Very good. Okay. Now, I'm just going to have a look up your nose briefly. You just want to check the nostrils. Make sure they're clear. If you could just tilt your head back for me. I'm just going to take a quick look up your nose. Okay, and the other side. Good. Can you hold one finger here and inhale? And the other side. Very good. Okay, close your eyes. Quick smell tests. I'll show you what they are. Here. One's orange. Oh, just gave it away. Sorry, it's mandarin. Can you smell that that's mandarin? You can. And what about you? Yeah. Okay. Very good. Just want to make sure there's no olfactory issues. Okay, I won't give away this next one, but inhale. Good. And you too. What do you both think? Yeah, that one is lavender. Okay, one more. And you. Vanilla. Excellent. Okay, write that down. All good. With tastes and scent. Okay. Well, do you know the last test that we have to do, or the last sense? Hearing and ears. Yeah. Okay. I'm losing it. Okay. We're gonna do a quick ear examination. Again, you want to put on a fresh tip for a new patient. I'm just gonna come to this side. If you could just look that way, please. Okay, and you can hold the ear and kind of like pull it up and back. And you just want to take a good look in there to see if there's any blockages. Looking around the ear. And behind the ear. Okay, very good. You could turn the other way. Thank you. Everything looks good. Don't see any signs of infection. Just palpating kind of on the earlobes. And if you just look at the ear, you want to make sure Okay. Good. Let's do some hearing tests. If you could close your eyes, please. I'm just going to make a sound with an object. Just tell me right or left. Okay. Good. 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 Good, okay. Now with my gloves, keep your eyes closed. Just tell me when the noise stops. Okay. I'm gonna start right up close. Good. And again. Perfect. Okay. We're going to do a quick tuning fork test. Okay, so this is a tuning fork. I know you've seen these before. You can just hit it and then ask the patient when they stop hearing it. Okay. It's a bit of a softer sound compared to the other sounds. So, okay, close your eyes. Did you hear that? It's quite soft. Okay, let's try again. Good. Very good. Excellent. Okay. So, lastly, everything's looking really great so far. If you want to be extra thorough, you can do a hand and nail exam. I always recommend it. You want to check the health of the nail beds, capillary refill, just make sure everything on the hands and the skin looks in good condition, okay? So you can just ask the patient to put your hands out. Alright, so I'm just going to examine with my light the fingers here. Okay. Good. And this hand. Okay. Can you flip your hands over? Just blinded myself. Okay, just checking the palm. Okay. Good. Just keep your hands like that. I'm just gonna press above the arms a little bit. Any numbness or tingling in the hands. Okay. Alright. So hold your hands like this. And then try to separate the fingers, but don't let me. Okay. Good. Good. Great. Okay. Make a fist. Good. And don't let me open the fist here. Okay. Good. Hold your arms like this. Don't let me open them. And now don't let me push them together. Keep them strong and don't let me push them towards you. And don't let me pull. Alright. Just raise your shoulders for me and don't let me push them down. Forgot to do that part. Good. Same thing with the head. Just resist. And on this side. And on the forehead, just push forwards. And on the chin. Alright. I have the reflex hammer, so I'm just going to go ahead and check your reflexes and then we'll be finished, okay? Let's do the wrist. Just relax. Good. And relax your knees here in the chair. Okay. Good. Alright. Well, that is just about everything. Did you take some good notes today? Good. Alright, so I'm very pleased to say that you are completely healthy. Thank you very much for being willing to be our test patient today. Alright. You can go. Okay. Well, do you have any remaining questions today? No? Pretty standard? Oh, okay. That made you feel a little tired. Okay. Well, you weren't doing all the work. I mean, that's okay. Alright, just go ahead and take a break, okay? Yeah. I think you'll be ready to pass your practical exam. I could tell you were paying attention very well. Alright. Well, feel free to let me know if you want to run through any more tests before you do have your exam. I'd be happy to help. Of course. Alright, well, you go ahead and take a break. Rest up.